things that are going to take us into reimagining healthcare in a very different way. So that's really what today is about, is to get colleagues, experts, from Sri Lanka, which has a very good health system and has done a lot of innovation, and get them thinking with us about how we can take health and healthcare to the next level. And, I also want to just mention a few things. One of the things that's also come out recently, of course, is that, it's not just about bringing people to hospital and treating them. It's about thinking of ways that we can prevent people from ever having to go to hospital, and also figuring out better ways that we can diagnose people and diagnose illnesses. So that's going to be an important part of our future. So it's not going to be so much about inputs, it's going to be outputs. It's going to be much more value-based, how we look and think about healthcare. And moreover, we need to really stop thinking about healthcare as a cost. We need to think about it as an investment in our society, investment in our people, that then leads to more productivity also within society. And I think, what we've seen, and again, countries in places like the United States and Britain have really had to step back, because they've realized just how social inequalities within their societies have really accentuated the impact of COVID. So even in places like London, we've seen the impact that it's had, particularly on people in inner city areas, poor communities, people who had jobs that essentially meant that they couldn't stay home, they couldn't isolate, they couldn't lock down. Those people have been more impacted and affected. And that's had lots of impacts, because many of them have long-term illnesses and comorbidities. And some of that also has to do with lifestyles, the way we eat, the way we really, think about ourselves and how we care for ourselves. And then, of course, the real important aspect of that is climate change. Many people who are on, have lower incomes tend to live in communities that are doesn't provide them healthy living. They live in more polluted areas. They often drink water that's not as sanitized. They don't have access to the same medical care. So that's really created something that we've always known, but putting it in this health context and realizing that if we don't go about equalizing and thinking about these issues, our healthcare systems will continue to be overwhelmed. They'll continue to be strained. And then the other thing that we've seen is really around supply chains, the way, the pathways, the processes, the way we think about how we distribute health, the way we, COVID has really been seen in many parts of the world very nationalistic, the lack of, global governance. So again, who leads that governance? How do we think about that in terms of innovation? If one country has a vaccine, how does that trickle over to other countries? How do we share that IP, that knowledge? And that is going to become more and more important as we all race to innovate, to think of new ways to do that. So we need mechanisms at all sorts of levels. So this is really, part of the mission of the Global Business School for Health at UCL, is to really tackle many of these, what I would call healthcare management topics and leadership topics, because they are critical. So we often think of healthcare just as doctors and often nurses and people that work in hospitals, but healthcare is much bigger than that. It spans over into technology today. It spans over into private-public partnerships. It goes way beyond our traditional kind of mindset. So we need to really think about the entire health ecosystem when we think about innovation. So lastly, I would just like to say, I'd really encourage all of you, to take a look at our website, look at some of our programs. We've got a fantastic MBA in health. It's not like any MBA you've ever seen. It's really got health in its DNA. It's been specifically designed for people who are really wanting to either pivot or take health and healthcare to the next level. And that is really our ambition, is to really train the next generation of health professionals. Those people, whether they come from a medical, clinical background, or whether they come from a business background, to really get them together in a room, pharma, biotech, digital health, and to really think about ways that we can work as a health ecosystem. So I'm really excited to listen to what our speakers have to say today. And I'm really very, honored and delighted to have my colleague, Adam Dubis, who's going to help out with us. And then a dear friend, Talal Rafi, who has, was a student at the University of East London when I was there, and has gone on and done some really amazing things. And I'm very proud of him as well. Just to tell you a little bit about Adam before we get going. So Adam has a research background in medicine. He's done a lot of work in ophthalmology. He's moved over into kind of the digital health space over the last few years. And he's really active in kind of that consulting space around imaging and digital health enterprises. He holds advisory roles with a number of charities looking to evolve their data and aggregate that to really analyze it and understand it. He's a visiting professor in addition to his roles at UCL, and he was recently appointed as the program director of our Digital Health and Entrepreneurship program in the Global Business School of Health. But he also holds a visiting professorship in Switzerland at the Université de Lausanne. And he's also a visiting professor at the University of Utah in the United States. So he's done a tremendous amount of innovation. He's got several patents in digital health space, and he's currently the founder of 2 digital health startups. So without any more delay, I'm going to let Adam introduce our panel and take us forward. Thank you so much.
Thank you. Hopefully I can live up to the great introduction. It is my honor to chair the questions here. We have 4 brilliant panelists here. As Nora said, Talal Rafi is a global consultant for entrepreneurship, having several different roles with the World Economic Forum and working as an expert there. We also have Rakshitha Tudawe, who is the executive director of the Durdans hospitals in Sri Lanka, as well as Sabrina Esufally, who is the director of development and innovation at Hemas Health, and Dr. Iraivan, who is CEO of Melsta Health, who is joining us today. So we have a series of prepared questions. Rakshitha has to get moving. So we're going to go to 2 questions for him first, and then we're going to do a round robin with the rest of the panelists. So the way it's going to work is I will ask the panelists the question. If there's any, so they will have about 3 minutes to answer the question, 3 to 4 minutes to answer the question. And then if any of the other panelists have any short comments to add, I will ask for that. So Rakshitha, how do you see innovation in the healthcare space?
So I see innovation rapidly changing, especially in the healthcare sector, because of technological advances, clinical diagnostics, which are rapidly evolving. And also a very important factor in what I see today is a convenience for customers in terms of coming into the hospital and getting the services and having the ease of access in terms of the total patient journey. And in terms of the innovation space, I think a part of what I see in the next 5 years, which is coming down soon, is the decentralization of healthcare, which is moving things out of the hospital, getting things in straight to the consumers and giving the ease of accessibility to healthcare to consumers from their own homes. And this has been rapidly changing, but challenging, especially when working in the Asian markets, because where we are late adopters, usually in terms of taking technology in, but because of the rapid change and also with the change of management, we tend to focus on adopting and becoming early adopters. So what I've noticed is in terms of clinical delivery, I think a lot of complex cases have started to become much more less complicated with terms of technology available, whether it be in theater operations or whether moving from open surgical operations to interventional procedures. And most people are being able to do head-to-toe procedures through interventions rather than going into surgery. And that is one of the most aspects, I believe, in the medical side, which is evolving. And also in terms of innovations in the tech side, which is coming directly to the customers. I think customers are looking at an ease of access to healthcare. The affordability of healthcare, which is very important today, as healthcare is quite expensive if you don't have an insurance cover. And what we see is that patients, well, compared to the last 10 years, I see a complete decline in occupancy because people are having a high turnaround time during go home by doing a day case surgery rather than having an overnight stay in the hospital because of the availability and the capabilities of surgeons performing surgeries in such a short period of time, and also the technology which gives them the capabilities to leave home as soon as possible. And I also think in terms of innovation, one of the most important things which customers see or patient typologies which come into our hospital is the complete ease of coming in and getting the service. I think as a part of innovation, I see innovation as tech, I see innovation as functionality, which is your ERP system, and then I see innovation from the side of management, where we adopt new processes and we work into bringing our standard operating procedures to make the whole patient journey more convenient, more experience rather than an interaction. And I'd say back in the day, you would get people coming in here having an interaction, but today the focus is on the total experience, and that involves a part of management innovations, which is working with new teams, getting in silo mentalities out and bringing in cross-functional and goal congruence between the whole organization. And that's what we've been currently working on, which is the cultural shift in order to provide that service. At the same time, what I also see is in terms of innovation, a part of innovations, well, there is an expense to innovation. But at the end of the day, the return of innovation comes in directly to the customers. And what we see is, as Durdans, we see that we want to bring affordability in care. And that's working with effective deployment and getting things like IoT devices in place to manage the whole patient journey. So we use a CRM, which was produced by Microsoft Dynamics. We've also listed with APAC Microsoft a few weeks ago on their website for the development of our CRM, which consists of 4 modules: direct to patient care, patient experience, and also a loyalty and also sales. So these 4 angles have brought us the experience to be more, I would say, convenient, more calm, and more intuitive in terms of getting response and immediate response. Whereas, say, for example, back in the day, if you get a complaint, you probably resolve the complaint by the time the customer leaves. So for us, we have a process where you get it directly once you're an admitted patient. Your surveys are pulled up, and then we get your feedback within that period of time of your stay of admission and just before discharge. So if there's any kind of inconsistency in service, because of the technology available, we're able to identify that and prioritize those complaints and take those into account so that we manage to satisfy all our patrons who come in and use our services.
Very, very good. So talking about these innovations that you're putting into place, so if I walk into a general hospital in 10 years from now, how is it going to be different than what we have today?
Well, I'd say we're still in the process. I mean, from what I've understood, still people will prefer to have that physical interaction with doctors because there is a difference of having and being physically in place. But there is the technology which is available right now where you can consult your doctor without coming into the hospital. But I think what the convenience or what the difference would be is, well, if you look at like what Nora explained earlier, there's 2 forms of being healthcare, right? That's the curative form of getting cured and coming into the hospital, i.e. coming in for your surgery to cure yourself or coming in for something to cure yourself. And then there's the preventive form. which is the mechanism of identifying any kind of risk or potential risk you are probably prone to get. And I believe with the new technologies of genome sequence, the new technologies of, the general things of doing health checkups, and the capabilities of identifying what kind of diseases you could be prone to with clinics which are coming up. And a very important factor, which I believe, especially since COVID, the psychological factor, which a lot of people in the past didn't really look into. But right now, it is revolving on the aspects of psychological management, where people will obviously come into the hospital when required, but people will use healthcare to prevent themselves and keep themselves in safe forms so that they know that they can predict or have a line of prediction of where they would stand in the future in terms of what kind of disease management they would get or what kind of complex diseases are there. And also what I think is, what I've been reading recently is, we invest a lot on investments in technology in terms of radiology, whether it's MRI, CT scans, to whatever it is, DEXA scanners, to any of these huge equipment which cost millions of dollars to purchase and procure. Most of these things are rapidly changing with Google coming in. And I believe image scanning will change in the future, and the adoption and affordability of healthcare will be much affordable in the future with technology that is rising. And the continuity of care as well, which is very important, because I think in today's world, or in the context of Sri Lanka, I would say continuity of care has yet to improve. And with all the existing technology, and referring to the question you asked me, how would people see healthcare coming in? I think people will be able to monitor themselves at home. They'll be able to have their vitals checked, which is already available right now. And doctors will be able to prescribe and also provide them that home service. And like I told you, the younger generation, which is even younger to us, they're looking at ease of access. And today, people don't want to come and sit for hours in a hospital, sit for hours and do procedures. They want it to be precise, to be fast and efficient. And that's how the hospital, the dynamics of the industry, moving from a spectrum from a tertiary hospital to a quaternary hospital, where you're looking at complex diagnostic cases, technology coming in here, then your functionality of system of having your procedures and functionalities of how things manage and work. I think all of those angles will change the landscape of healthcare. And especially also in Sri Lanka, with all the hospitals in Sri Lanka and the private sector, or even whether it's the state sector, things are rapidly changing. And one of the most important factors, I think just innovation technology is very, very important. But one of the most important things, which a lot of people don't see, I wouldn't say it's the sense of innovation, but the investment in human capital. If you don't have the right people working in the right place, you're not going to have anything just having technology out there. It's the people who make use of the technology and its skills and the availability and the new ways of teaching, moving away from the mainstream methods of teaching. I believe we have a backward integration arm which is into education, and we teach very differently to how the general mainstream education is, because we use technology like VR for scenario-based learning, whereas a practical nurse won't really get to exercise that in a live scenario until they actually start working. These methods actually fill in the gap in which gives the whole cross-sectional service delivery of healthcare, which is from A to Z, from a customer or a patient or a patron entering the hospital, giving that ease of access from the touch point of customer care, from security, from housekeeping, and then direct patient care with direct patient surveillancing with nurses and doctors, and the nurses being the most important thing. And the technology that is being adopted by nurses today, and for them to learn as well in order to expedite, in order to provide the services, it's a lot of upskilling. And from our end, we believe in empowering, and we believe in enhancing the skills of our human capital, and that's using technology. So I would say, in terms of innovation, I would say we're not people who create. We're not the Mayo Clinics of the world, or we're not John Hopkins where we do research, but we are early adopters of innovation. We take in what's going on in the Western world, and we implement it, and we take it on board. And those are some of the things which I believe which will change the dynamics of the healthcare industry.
Very good. So do any of the other panelists have comments where they think healthcare will be in 10 years? So I guess the one point is do you believe that doctors will have more time or less time to interact with patients with the advent of technology?
Well, so you see, if you look at the EMR, I mean, the basic electronic medical record, you do get the vitals of the patient before coming in for a consultation. So it makes it much easier for a doctor to make a clinical decision. And specifically with the connectivity to AI being a part of EMR, well, I don't think at our hospital we still have that, but with our new future state of our investment, which we're making for next year, we will be adopting AI in our clinical delivery as well. This would change the decision making of a doctor, so he could easily make a decision based not only on his personal judgment, but on experience which has happened worldwide, because AI is a combination of information which is brought into an algorithm and makes your decision much easier in order to give a clinical computation. And I believe, yes, it might reduce the timing, but it won't reduce the, or it won't mitigate, or it won't bring down the service delivery.
Can I ask a follow-up question? I would really like to know how you see the role of nurses evolving, because I think that's an important part of this equation. If we can do more diagnostics with AI and technology, how will that impact that particular role within a hospital setting?
From my experience and from the experience of our healthcare group, we have an education arm which we set up recently called AMRAC Institute of Medical Sciences. And over there, we are actually producing human capital for the whole healthcare industry. And it's not only nurses, operation theater technicians, cardiac care technicians, phlebotomists, MLTs. We're looking at all angles of skilled delivery healthcare professionals. But nursing, because it's a worldwide problem, especially in the UK, as you require 40,000 nurses a year, AMRAC, we are producing our nurses in accordance to your NMC standards. Our nurses who study with us have the access to CBT1, CBT2 in England, and they get their registration. And we're also in a potential tie-up with them in West Midlands to provide nurses for the United Kingdom and the West Midlands, and also the fact that NHS provides free masters for all of the students once they complete our degree program at AMRAC. I believe the importance of nursing, it is very important. And one of the main aspects in terms of international trade of nursing, they look at English, which is very basic. I mean, I would say it's very basic, but when you come into a country where English is not your first language, it is a bit challenging. But because we created our curriculum to be acceptable to the Sri Lankan medium, we've used all of these ways of teaching, like KSAM. We do not teach on the basic lecturing, which the normal norms of our state teach, which is the NVQ6 curriculum. We actually follow our own teaching methods where we use seminar-based teaching, small group teaching, and we get students to take in charge of classes to teach other students. It's a very different form of teaching, but it's very difficult, especially when the mainstream education system still hasn't changed. But because of our training and continuous support we give to our students, we've started to see a difference. We started to see a difference of interaction, nurses challenging the status. Now, I mean, to be very frankly honest with you, nursing in Sri Lanka is looked very differently to how it is in the Western world. I mean, in the Western world, a nurse is one of the most important people or persons in an organization in healthcare, because they're the ones who spend most of the times with the customer or the patron or the patient. And we are trying to change the mindset or the hierarchical levels of how it's established in the Sri Lankan culture, where a nurse would never challenge a doctor. But with the way we train our nurses, if they see something wrong and the doctor doesn't see it, we expect our new nurses or the nurses we're producing today to be able to challenge the status quo. And that's what we're gearing. I mean, that's our passion and that's the pride which we all held to produce good human capital. And I think nursing is one of the most fundamental things, whether it be in the operation side, whether it be neonatal, whether it be in radiology, whether it be on basic bedside nursing or basic bedside surveillancing. Nurses are the most critical human capital functions of healthcare. And if you do not have good nurses, there is no point having innovation. There is no point having technology. There is no point having systems. because if you do not enter the right data or data to the systems, you're not going to get the output coming in, or the clinical output, or the patient surveillancing output, because end of the day, it's the person who enters it, adopts that innovation, and makes use of the innovative technology out there. You could buy, I've seen failed examples in our hospital where we've invested in technology, which we've brought tablets, we bought many kind of EMR systems for our inwards, but the functionality of Wi-Fi connectivity will be low, functionality of the UX and the UI, the user experience of the people using it is not so functional, and that affects the whole delivery of using and adopting that innovation. And that's the most challenge which we face in our healthcare institution. But with this challenging environment, we still believe in empowering and continuously working on our training and development of our skill resources to update themselves, keep them updated to the technology. And the most important thing is the connectivity and the goal congruence between all departments. Because I think still up to today, the global discharge time in anywhere part of the world is still around 90 minutes. I still believe is a very long time. It can easily be minimized, especially with blockchain coming in, especially with all the technology which is coming in terms of getting all the reports and everything for a discharge process to be much faster. But yet, even with all the technology we have, we still take the global standard is around 90 minutes. I might be incorrect on the exact amount because this is what I recall from what I read about a year ago. And I think hopefully with all of this nursing coming in and providing good human capital, it will be able to change the dynamics of healthcare.
Thank you for all of your great insights into how healthcare is going to change, especially the humanist parts of this and how they're going to interact. I want to move on to our next panelist, Sabrina. So we've talked about the human side of things. So what do you see as the greatest need in the digital healthcare space?
Mm-hmm. Thanks, Adam. So I think, for me, I've really been watching the evolution of this space and how important it has been to ensure that we essentially bring together brick and click. And for me, I think really innovation lies in that ability to seamlessly integrate the two. Because previously, and Rakshitha did allude to this in some of his comments, previously, a big part of how digital was viewed in our businesses was very much outside the core business. So you had, a team of really smart, digital savvy, professionals that used to work on the digital solutions. And then you had sort of the core sort of brick and mortar team that used to run the hospitals. But I think now, we're realizing more and more that it's integral that we have solutions that bring these two things together. So for me, that is the greatest need. It's, how do we seamlessly integrate the brick and the click? And at Hemas, we've kind of set out a really bold vision to touch 10 million lives through a combination of brick and click services. And just for reference, that's about half of Sri Lanka's population. And we're currently kind of putting in digital transformation projects to ensure that we're able to really reach more patients with our services, patients that, either may live in remote areas that may not be able to really access the brick, or patients that really may be unable to afford the private healthcare system with all its bells and whistles. So really, can we ensure that, with digital transformation, we're actually able to drive down the pricing associated with private healthcare? And there are two kind of things that particularly interest me in the integration of brick and click. One, it's, what is the role of predictive analytics in ensuring increased precision in diagnostics. So, particularly in a country like Sri Lanka, where our doctors don't really get the benefit of scale, where, our doctors don't, just by virtue of the size of the country, you're not really seeing 1,000 or, enough cases you need to really form a rounded opinion based on, specializations and based on sort of unique disease profiles that seem to be emerging. So what predictive analytics can actually do in our businesses is essentially ensure that as the doctor is typing in particular symptoms, that it's actually throwing up the kind of diagnostics that that essentially rely on, global and regional trends, right? So you're not really refined to your knowledge base or your patient base, particularly when you live in a, not on an island with 22 million people. So I think, that's brought a lot of interesting scope in our businesses. Secondly, something that's very close to my heart is, how the integration of Brick and Click can actually improve patient experience. There are sort of two pain points that I think, has really, is something that the Brick and Click sort of integration is geared to solve. One is with outpatients, it's the constant sort of frustration around how long you have to wait to see a doctor, right? So, the fact that, with a digital solution, you can now know, when your doctor is in the hospital. You can also channel your doctor online, and then you can ensure that you use your sort of e-pharmacy and to essentially get your prescription at the end of that journey. So you really reduce the pain associated with an outpatient visit. Secondly, for inpatients, something that continually causes a lot of pain points for patients is this idea of a bill shock, right? So you go into a private hospital, thinking that you're going to pay a particular sort of fee for your service, and then you end up, way out of the zone. So, with digital solutions, can we actually increase the idea of transparency and predictable pricing so that the patient is fully aware of the kind of, the kind of cost associated with that healthcare service? And the other thing with sort of inpatients, a pain point that digital healthcare is sort of primed to solve is this, you want to, as soon as you're cleared to go, you want to get out of the hospital as soon as possible. But typically in a country like Sri Lanka, it can take up to 2 to 3 hours to actually check out of the hospital. So, even once your doctor has cleared you. So, can digital solutions actually intervene in that pain point and really ensure that, that we have a digital solution to bring that time from, say, 3 hours to 15 minutes, right? So I think that's where, you constantly, the benefit of bringing the Brick and the Click together, just to sum up, is that you can take a long, hard look at the entire sort of patient journey and the value chain, and you can really see what the pain points are in our current sort of model of hospitals and healthcare and physical healthcare services, and you can really design digital transformation projects in the gap. And that's something that we've seen work quite well for the business and actually complements the overall health outcome of the patient, and of course, begins to increase the efficiency associated with running the business. Yeah.
Can I ask a follow-up question? So, I mean, all of that's wonderful. And I just imagine going to the hospital be like going to a hotel and I get my bill put under my door at the end and I just walk out. But how, because one of the things we're finding in the UK is as we get these digital solutions and we start to make things more efficient, two things. One is more people access it. So, when we started having mobile apps, for example, where you could see a doctor on your phone, now the doctors are overwhelmed with all sorts of minor, requests and things. People who would have never gone to the doctor because it would have been too much effort. It would have taken too much time. But now they can do it just very easily. And so people are actually over medicating themselves or wanting over treatment. So how do you deal with that? That kind of, and then the second thing, that kind of bifurcation, what we're seeing is if you've got private insurance or you've got access to private services, you're getting a different kind of experience than you'd get in the NHS here in the UK. And so that worries a lot of people, particularly people who are, really champions of equity in healthcare, because what they're seeing is a bifurcated system where we will soon have certain segments, people who can, pay, having a different experience than those who are, accessing the NHS. And that's worrisome in a country where we pride ourselves in universal coverage. So how does those 2 points fit into what you're saying, and what are you seeing?
Great questions. So I'll take the first one. I think, culturally, I don't see us having that problem because Sri Lankans generally love, seeing a healthcare professional for even minor things. So I think we already have kind of that issue culturally baked into the system, and I don't think an efficiency improvement would drive that behavior. That being said, over 80% of Sri Lankans actually seek solutions in public healthcare. And so, what my experience is really talking about, how private healthcare is really improving some of its services and the digitization aspect of it. So I think to answer your question, I don't see a huge shift in terms of, people's propensity to see a doctor just because it gets easier. Because of the cultural considerations and because of the current sort of health-seeking behavior right now. To your second question, extremely valid, and I think this is something that we're trying to solve as a private healthcare issue, an issue that we see in our business, obviously. But to do that better, what we've done is, Hemas, we've partnered with IFC to really help us navigate this sort of digital transformation journey, and so we're working with sort of experts to actually come up with a blueprint that we think could serve well for South Asia as it thinks about its sort of digital transformation journey. And this is not just about, improving the standards of private healthcare. This is more about, understanding the typical sort of cultural and healthcare needs of the region and trying to kind of improve digital healthcare adoption across the board. And certainly, something that Hemas has always done is work very closely with the government sector to offer expertise and to offer funding where needed to really to bridge the gap so that we avoid sort of gross inequalities in healthcare outcomes. Yeah.
Thank you for your great insights. So I want to move over to Dr. Iraivan, the medical practitioner on the panel here. It'd be great to hear your insights. So the global healthcare systems have been crippled by the COVID pandemic. What business opportunities do you think could come up that would support the recovery from this? You're on mute, I'm sorry.
The COVID had put us in a big trouble, but I see a lot of opportunities coming up from this entire scenario, the COVID scenario. That is first thing what I can say is even the vaccination discovery, it's a greatest innovation probably in this century, and how soon we managed to get a vaccine out, which gives me hope that the entire healthcare delivery is going to change in the future, which is going to give us a lot of opportunity. That is number one. And while going through the entire COVID painful process, we also identified a lot of opportunities where the healthcare could be supported. Something like even Mr. Rakshitha also mentioned it. The human power shortage is a main issue all over the world. I could see to start up an opportunity, even not only hospitals, even anybody who wants to start a healthcare related business should invest in a human resource development, especially like nursing, paramedical, and everywhere. Because in not only in Sri Lanka, this part of the world, even in your country, I see there is an opportunity is there which we could capitalize it. So it's not necessary it should be attached to the hospital or healthcare providers should do. Anybody who wants to do can do. Other thing is opportunity for medical instruments and equipments, because when this COVID came, we all realized it. What we have is not enough to manage the entire requirement. So, but unfortunately, there is a supply demand issue came. I believe as an investors should look at something to manufacture certain fundamental equipments, like ventilators or any medical care, related equipments. That is something opportunity which I see unfortunately in this part of the country, especially in Sri Lanka, there is nobody is taking the steps to do it, maybe due to so many reasons, but there is a big opportunity lying there. in order to support the crippled healthcare services in the world. And other one is because of the COVID, people are reluctant to come to the hospital. They're scared because they will get infected, or they are scared of is there a phobia going on there. A home healthcare service, because, and also this had prompted the people to get used to the system where they could take medicines from home. Even, you know, like I see in the future home healthcare, because you don't like to, I mean, earlier we have to go to the hospital, and if the hospital could go home, or hospital on wheels, something, that concept is developed, definitely many part of the population could be benefited, and developing countries like Sri Lanka, India, and this part of the world, the medical healthcare reach is not there. So I'm sure the home healthcare services currently just done as a laboratory test or something like that. If the doctor could go, or if there is a community related, some sort of a reach could be done, that will definitely help support the crippled healthcare, I can see. And other one is pharmacy and drug delivery. Even, you know, during the COVID time, we could see even Uber and Pick Me like services were involved in medicine delivery. So if somebody wants to start something, and also because of that last 2 years practice, people are now not used to coming to the pharmacy. They are ordering, e-prescriptions are increasing, and through WhatsApp and everything. So people are getting used to staying at home and getting the treatment unless otherwise is indicated, for their safety and also cost effectiveness. Because coming to the hospital, and also seeing the doctor, and so the transport and everything, and convenience. So these 2 years had made them to program their mind towards a convenience. So even a medical delivery could be done, medicines delivery could be done. So these are the opportunities I see in the future, especially after the COVID or during the COVID. The opportunities are coming up to support the healthcare services.
So
Can I interject there and just say, whenever I hear people talking about that, and I think, you know, we're definitely going that approach, and more will be done at home. What worries me is compliance, patient compliance. So we already find that, you know, after 3 months, the research shows that actually about half of the population will start to take their medicine in ways that were not necessarily compliant with how they were prescribed. Then we're talking about, particularly if we're talking about Europe or you know, places in the West, we've got an aging population. Are we assuming too much when we ask them to, you know, self-medicate, and how do we deal with people who have dementia and these sorts of things? So is there limits to what we can expect out of the population, and how do we nudge them to comply?
Yeah, I get your point. In fact, being a medical practitioner, definitely the direct touch and feel with the patient is definitely important. And also for a patient, for themselves to heal is important. Yes, there is a good point you are bringing about the compliance, but probably the COVID had taught us non-compliance and the repercussions of not doing the right things. I'm very sure with the technology and even the COVID is not going to be over. It's going to be there for another 2-3 years time. The lesson what we have learned during this time, I'm pretty sure the compliance rate would improve. But I do agree with you. There is I can't say 100% compliance, and especially dementia and elderly population, because the vaccine had come out in 6 months time. So that's a clear example. The elderly population is going to live more because the more medicines are coming, and aging is going up. So those people, of course, definitely have to come. At the same time, the more aging population will be also reluctant to come to the hospital due to, one, convenience, two is the safety, and 3, getting used to the system. So it's a balance. Probably we may have to do it between the home care services and the hospital. And if you take this part of the world, as Sabrina mentioned, still people would like to come to the hospital and see the doctor and say hi. Whatever it is there, there is definitely a point is there. I'm sure it must be there in Europe also. Yes, I do agree. There is a level of balance needs to be done there. Yes.
Right. Do you mind if I just get into the same question, Nora, you just asked on compliance?
Yeah, go ahead.
Yeah. So I do agree with Dr. Iraivan when he was mentioning about compliance, and certain norms of compliance can be changed with the effective to the external environment. So, well, at Durdans, we are a joint commission international hospital, so we do follow the protocols of patient safety and patient delivery. But what I noticed is obviously we do not at all compromise to the clinical delivery and the clinical patient safety, because we are year on year in compliance, and we have our JCI team and our quality assurance department, which works on a documentation basis. But from my experience, because I also do work, I may not be a doctor, but I am involved in clinical areas and I do set up clinical divisions. What I noticed was sometimes with compliance, it's a lot to do with documentation, but than actual patient safety. And that's what I've experienced in terms of maintaining our accreditations with the United States. It's a lot of documentations, but then that hampers the patient delivery and the direct patient care, because most of the nurses are always on documentation. And then where is the time which takes in to give the delivery, give the experience, give that direct patient care? And but I do not, of course, say that you cannot be non-compliant. Of course, compliance is very important, but I think adoption and a little bit of change, because everything changes. I mean, information changes every 17 months, right? You can't say what you did 8 months ago or 12 months ago will be the same thing. I mean, we all didn't have iPhones 15 years ago. We all didn't have Android APK apps to download 15 years ago. No one had the ideology of apps coming in and integrating into health systems. So I think compliance is very important, especially data security side, and then compliance on patient safety and delivery. But as Dr. Iraivan said, sometimes non-compliance can take a form in order to maintain the external environment, change of environment. I mean, during COVID, there were certain things which we wouldn't have normally done on a normal norm when it was a normal hospital. But because of the adoption of COVID and self-learning and self-experience, we started doing things the way we see things. So not just sticking to a book or doing research online and adopting things, but self-learning on the way patients come in the way the whole triage process works, in the way to isolate patients, especially during COVID times, because we did run few COVID wards within our hospital sector. And at the same time, we have normal patients coming into the same hospital. So adopting new ways of giving that access. So if we had to be in compliance, then we wouldn't be able to have COVID patients in our hospital, because obviously it'll create infection control issues, or it'll create issues for the people who are coming in for normal services when there are COVID patients coming in as well. But then adopting and changing the norms of actually what we did was we created a pathway and a process where you don't even see a COVID patient coming into a hospital. You go straight from the basement straight to the ward. It's all protected. It's all adopted with the current external environment. And these are things which the management who are empowered in our hospital to make those decisions, they're the ones who came up with these ideas. And it's not what we get from our partners who we work with in terms of maintaining our JCI accreditation. I think, and based off what you know, Nora, yes, compliance is very, very important in order to maintain the safety of patients, but also what Dr. Iraivan mentioned, I think non-compliance at the same time during a situation should be adopted in order to mitigate any issues. And of course, you can obviously make mistakes. People make mistakes in the world. You're not going to be perfect all the time. But when you learn a mistake, and if you make a mistake, you immediately rectify it. You immediately take action to rectify or identify what the root cause for that problem was. And that comes in also with the systems which are built in in order to mitigate issues like that. And I do agree. It's a question on whether you agree or disagree, but it's based on both sides, because I think there's two sides to seeing compliance. And from my experience and from what I've seen in Sri Lanka, I think compliance can be amended as long as it doesn't directly affect the clinical delivery of patients and doesn't compromise the patient delivery. But of course, non-compliance also would be subjective to use when required at the right time. Thank you. And I would be leaving a bit early today because unfortunately there was an unforeseen circumstance. So I thank you all for your time and giving me the opportunity to speak. And I was really looking forward to today's meeting, but I have to make a move. And thank you very much.
Very good. Thank you. So Talal, you're a serial entrepreneur yourself in several different spaces. It'd be interesting to get your opinions on what you think some of the challenges are in the healthcare sector, and especially how they compare to other spaces, other entrepreneur spaces.
Right. Thanks, Adam, and thanks a lot for having me. It's a pleasure being here. And speaking about challenges for startups, I would say that this particular industry has unique and a bit more challenging challenges, I would say. The first thing, as the other panelists said, is the focus on human capital. So in this, like, if you want to have specialists like doctors, scientists, or other people with who have specialized skills, the cost is quite high. So when you want to recruit these people who usually have good careers, work in established firms, and you want them to move into a startup, which is quite uncertain, and the salaries are low, that's a bit of a challenge. At the same time, that's also a reason maybe because specialized people in the medical field tend not to become entrepreneurs, because they are leaving a quite safe career to come into a sort of a risky environment. So that has been, I would say, one of the biggest challenges when I speak to experts, especially in the health sector. The other thing is regulations. I was speaking to a person in India who heads a health sector startup ecosystem. And he says one of the biggest challenges is regulation. So certain things such as pills, injections are out of reach for startups. Only the larger companies could have the resources to do that. And regulations differ by region. So recently with the ADB, I was with their Digital Against COVID-19 Innovation Series as a selection committee member. So one of the biggest challenges for them was that the regulations differ with each country. So even when you have a country, I mean, within a country, within the states, the regulations are differing. So that's one thing. And delays, as it's very common in Sri Lanka. So they say approval could be 6 months, but then when you actually go into it, it could take a year or a year and a half. So what we find is that the investors, you have to keep them calm as well. So these are some of the challenges. And another thing would be co-founders. Like when I look at health tech startups, most of the co-founders come from a similar background. And it's like they're extremely good in their skills, like technical skills, but they sometimes lack business or entrepreneurial skills. So that is a sort of a challenge. And the same thing, like it goes to when pitching to investors. That's the other challenge is that investors sometimes don't seem to understand much. And when investors look at areas where they don't have that much understanding, they tend to usually skip over. So that comes to the other thing about the longer returns. So investors nowadays, looking at Silicon Valley, it's more like invest, make the company scale extremely fast, like Uber, even if it's going at a loss, and then sell it off, put it on an IPO and sell it off. But here it's that the returns are very long term. So it's in some cases, it can, for example, when you look at the vaccines for COVID, we got it within a year, but that was because of global pressure. But the experts say that in a normal circumstance, these vaccines would have taken on average 7 years to develop. So that's how long. So getting investors with that much patience could be a bit of a challenge. And lastly, infrastructure. So we need some of the solutions would be to universities, partnering with universities. So yeah, so those are some of the challenges. If you want, I can talk on some of the steps as well to address these.
Can I just interject there? Because where I see a lot of the kind of innovation is around digital health. And digital health is really complicated, right? Because, you know, even if you think about Apple Watches, they really came out originally and Fitbits as consumer products, you know, not as health products. So, you know, it's very murky space. And, you know, there's you know, in places like the United States, you see many products that are going around kind of regulations because they use these kind of gaps within in the laws. Do you see a further tightening, or do you think that because of the day and age we live in and with all the innovation and the idea that healthcare has such a need, that we'll actually see it relax, that will go forward? Or do you see regulation going back to tightening down again after the pandemic? What are your thoughts on that, and how do you see startups particularly responding to that?
So talking of that, I think this is my view. And speaking of that, I think it's going to might be a bit difficult to regulate these organizations, because you see a lot of organizations like Apple is like you can say the last, but Google, Amazon, they're all going more into the health sector. So one of the startups I was talking to, they were saying that they couldn't even find normal investors, and the only investor who had the patience to do it was Google. So so I see that as it becomes, but it also the part about having a more digitized world is that it's a bit, in certain ways it's sort of easier to regulate, but in some ways it's quite difficult.
Thank you. So last two questions. So building on this digital space, Dr. Iraivan, I'm curious, as a medical practitioner yourself, one of the challenges that we have in deep tech is trying to understand how AI-based assistant is actually making its decision. Is the accuracy important, or is understanding how it makes its decision important?
Yeah, I think it's both are important, but when it comes to the healthcare delivery, especially as a doctor-patient relationship, whatever said, there is a famous saying we have: "Don't treat the laboratory, treat the patient." That is what always we see, because most of us, especially with this, Dr. Google is doing a lot of things these days, and even the medical doctors, while treating, they just refer everything. So AI, yes, I do agree, it's is inevitable in the future. But when it comes to the reality, I think a proper clinical examination and clinical care delivery is important. I don't think AI can replace it. AI could complement, but what I feel is AI cannot replace real health examination by a physician. So it's not going to be it's going to be a challenge, because there is another issue we have is because of the AI, even patient has an access to check what is wrong, and they do the research before they even see the doctor. So it's going to be a challenge for the medical practitioner, even though there are two sides of AI, because before seeing the doctor, the patient is aware and patient has so many questions. Against around 10-15 years ago, patient is totally at the mercy of the consultant or the doctor. So it's a challenging, especially for a medical practitioner, even in a day-to-day life. But definitely AI is complementing and giving a lot of insight about patients' well-being, especially like personalized medical care, personalized treatments for the cancer treatment, and all is there. So I feel it's a complementing, but of course, definitely is not going to replace, or it cannot be. It's going to be a part of the clinical management process.
Very good. Talal?
Oh yes, I just wanted to add. I agree with Dr. Iraivan. Is that when you look at for example, talking to a doctor over the phone or getting advice over the online, one of the problems is that there was a recent event where somebody had a certain thing, like I think it was dengue or something, but the problem is that they didn't go to the hospital. I mean, if what the doctor said was if they had gone to the hospital, they would have found out the actual thing. So it was a sort of an error. So I agree with him that, in-person treatments would be a main thing.
Okay. Okay. So last question here. So Sabrina, your position has really been on driving the innovation pipelines and understanding the consumer trends. So based on your experiences, what do you think is the greatest healthcare innovation of the last 5 years?
Yeah, so actually Hemas is a really interesting, sort of occupies a really interesting space in the healthcare value chain, because we do sort of distribution of pharmaceuticals, we manufacture our pharmaceuticals, and we have hospitals as well. So, I feel very privileged because I get to see sort of the whole value chain and, how patient healthcare is evolving, both from a preventative side, but also more importantly, from a predictive and a preventative side. And I think, something that we've seen really advance at lightning speed over the last 5 years is the role that predictive healthcare is really occupying in sort of the healthcare industry, right? So in Sri Lanka, the non-communicable disease burden is high. It's growing exponentially every year, and this is something that can't be sort of addressed with hospitals alone and medication alone. So, personally, I've seen how wearable technology has really helped patients navigate their lifestyle choices much better, navigate their their well-being much better, their diet much better, and really using that sort of day-to-day nudge to ensure that patients choose healthier options every day, is something that I think will have incredible value on overall health outcomes. And this is something that we really need to accelerate, so that that patients aren't only seeking good health outcomes, when it's too late. And I think, there's also been interesting advancement in the whole sort of gene mapping aspect of things, where you can actually, understand the kind of diseases that you may be more susceptible to because of your DNA and because of your particular predispositions. And I think, that's really going to help us personalize medicine a lot more, right? Because, now it's a very much a one-size-fits-all model, because obviously we don't have the data that we require to really customize our healthcare solutions. But, I'm pretty sure with the advances in technology and also, the increased amount of data that we seem to be collecting about our patients, and also the ability to really understand healthcare prediction a lot better. I'm looking forward to a world where, you and I could have the same disease, but we'd be treated very differently based on our own sort of unique compositions. Yeah.
Very good. Well, we've went a few minutes over here, so I want to thank the panelists for bringing all your great insights to the discussion today. There's a lot of great information out there of investing in the humans and just how is innovation going to drive the healthcare space, whether it be the humans, whether it be streamlining processes, or as you finished there with Sabrina's trying to personalize medicine more through data. So I want to remind everyone that this is being recorded and it will be put up on the Global Business School of Health YouTube channel. So if anyone would like to refer to it back in the future, it will be there for your viewing pleasure. With that, thank you to the panelists for taking the time out today and giving us your amazing insights.
Thank you.
Thank you so much. It's really fantastic listening to all of you. Just real fantastic insights. So thank you and have a very lovely day.
Thanks. Have a lovely day. Bye-bye.
Thanks, everyone.
Bye-bye.
Bye.